The last part of this talk focuses on coping with inflammatory bowel disease. Being diagnosed with a chronic condition can be very devastating for families and the child, and addressing this is equally important as controlling the disease. It is important to understand how inflammatory bowel disease affects the child and the challenges they face. Many have to cope with the physical symptoms associated with the disease, the need for frequent toilet visits, the pain, passage of bloody stools, which may be scary to a very young child. There is also the emotional challenge of being different and the loss of being normal, and sometimes children feel very angry or even blame themselves that something they did caused this. The disease can also affect the behavior of the child and affect energy levels and sleep. Then there are medications which need to be taken on a regular basis. These may be difficult or may be very unpalatable. There may also be side effects of the medications. Some experience hair loss, headaches, skin changes such as acne, which may affect the child. The impact of the disease will also affect their school. Many have frequent episodes of absenteeism. They may have to inform their teachers regarding the need for frequent toileting. And they may also be worried about their friends, whether they will get teased for needing the toilet frequently. They are also unsure whether they should talk to their friends about their disease. And of course, they're worried about missing out on all the normal activities that their friends have, such as school trips or camps when their disease flares up. Now, of course, parents and caregivers are also faced with a whole lot of stress. They have difficulties in seeing their child in pain and discomfort with such frequent disease flares, frequent blood taking and visits to the hospital, and feeling helpless or this loss of control. Parents also need to adjust to their routine to ensure that medications are taken in a timely manner. They have to adjust their work schedule to ensure that they attend the frequent follow-ups that their child has. And parents may also worry about whether they have to make major lifestyle adjustments as a family, especially in relation to the dietary habits of the family, travel, and family activities. This may have an impact not only on the child that's affected, but on other children or family members if the attention is now diverted to the child with the disease. And of course, there's always the worry about having a child with a chronic lifelong disease. And of course, they worry about the future, especially in terms of school attendance and performance, and even on the impact of this disease on the long-term future of their child. Stress has a very big impact on the family and patient, and can even contribute to flares. Now, the main targets on minimizing stress for caregivers are, firstly, disease acceptance, and obtaining social support and promoting resilience. Perhaps the most important is disease acceptance, both to the child and family. Acceptance comes with obtaining adequate information and understanding of the condition. This is usually provided by the healthcare providers, which could be physician, specialist nurse, pharmacist, dietitian, and social worker. There are also a lot of resources available through the various society support groups, including easy-to-understand stories catered to young children for them to understand. It is also well recognized that inadequate social support increases the risk of anxiety and depression. We are mostly social creatures, and knowing that we have someone we can trust to turn to during stressful times certainly provides a lot of comfort, whether it is family, friends, or even others who are in a similar situation as you. Resilience is another important trait to have in order to reduce stress, and resilience refers to our ability to recover from or adjust to adversity. This slide illustrates some practical strategies that you can use to help with coping with an illness. You need to be open with your child. You need to explain what's happening in words to your child that they can understand, so they don't imagine other things that could happen, and be as honest as possible. They may get upset about having to go through uncomfortable tests and taking unpleasant tasting medications. Acknowledge they're upset. It's okay not to be okay and to express this unhappiness. During flare-ups, remind them and reassure them that this is only temporary and that they'll soon feel better after the treatment. Focus on the positive, what your child can do rather than what they can't. Try to break tasks into manageable steps and celebrate every little success along the way. If possible, try not to restrict your family life because of your child's condition. If your child has a relapse, you may want to postpone certain activities or outings until they feel better, and reassure them that they won't feel the same way forever. During flares, it might be useful to find a flare hobby. It gives your child a happy way to pass the time during a flare, and it'll help them to soften the blow. You could try reading a book or listening to music, playing computer games, or learning a new craft or skill. Get your child involved. Encourage your child to ask questions and describe how they are feeling. Show them simple ways to manage the condition, like taking more responsibility for managing their own medicines, and give them choices where possible. Be there to guide them along the way. It's useful to meet other families in similar situations so you can share your experiences and you can learn from their challenges. It is especially reassuring to see children whose disease is well controlled and leading normal lives, and it often gives parents a confidence and reassurance. Another practical approach to minimize stress is to stick to routines. Have positive involvement in activities. Participate in social groups. Maintain consistent school attendance as your child is able to. Try to engage in normal eating habits and ensure that they have a very well-balanced nutritional intake. Ensure good sleep hygiene. Have a predictable daily schedule, and that includes making sure that you take your medications regularly at the same time. Now, if you notice that your child has a change in behavior, such as becoming withdrawn or isolated, avoiding friends and social situations, having trouble sleeping, or acting out at school at home, your child could be experiencing stress, anxiety, or depression. If you notice these, you should seek additional help and talk to your doctor about it so that your child's emotional health can be addressed. Yeah. If you notice this, okay. If you notice these, you should seek additional help and talk to your doctor about it so that your child's emotional health can be addressed. There are different strategies to help improve your child's emotional well-being. It could be as simple as encouraging your child to talk. That could be the first step. You could also ask your child to keep a diary and write down how they feel. You could encourage exercises in mindfulness by practicing deep breathing, meditation, or yoga. There are many apps like Headspace or Smiling Mind or Cosmic Kids. These can guide them through these techniques. Physical activities are important, such as walks or taking part in sports or exercises that they enjoy. You could even try art or music therapy, which may be beneficial to them. Sometimes it is as simple as just doing activities that make your child feel relaxed, like watching a film, reading a book, or playing a game together as a family. At some point, some children may need additional help, and you may need to seek the help of a counselor for this. Living with a chronic disease has many challenges, but it's equally important to remember that most children with inflammatory bowel disease actually live full lives in spite of their illness. They go to school, they work, they raise families, travel, play sports, and some even run countries. We talked about the characteristics of ulcerative colitis and how it is diagnosed and the treatment strategies, as well as the strategies for coping with a lifelong disease. Although this is a lifelong disease with many challenges along the way, remember you are not alone in this journey. With the help of your healthcare team, family, and friends, you can actually help your child enjoy all that life has to offer and continue living a fulfilling life. Thank you for watching this video.